Thank you, Chairman Palmer and Ranking Member Clark, for holding this important hearing and for our panel for testifying with us here today. As with many other sectors, as technology has advanced, our healthcare system has become increasingly dependent on a variety of interconnected devices. The ability of medical devices to connect to and communicate across networks yields tremendous benefits in terms of the availability of real-time, accurate health data. This data is critical in improving patient outcomes and efficiency of care, while ultimately with the goal to hopefully lower costs. With widespread interconnectivity in such a critical and sensitive system as healthcare, we must be especially cognizant of the potential cybersecurity risks. I recall when I started my training as an intern at Johns Hopkins in internal medicine, we made home visits. We were given a map of East Baltimore. Today, these same young interns go out and do these home visits, but they have connectivity. They have ability to take their devices with them, and they don't have to be looking at a map to find out where the patient is they're going to visit, but they bring sensitive data with them on their devices. I would like to focus on some of the risks that exist as the health professional and patient level when dealing with potential vulnerable legacy medical devices. Dr. Damuth, as a physician and as an educator, do you feel that medical students and residents are receiving the adequate education and training regarding the potential cybersecurity risk of the devices that they utilize each and every day?
To my knowledge, there is not a standardized curriculum at any medical school across this country regarding the risks of digital healthcare, up to including cybersecurity.
Should there be?
That is a interesting question. I personally believe so, that we should be equipping our next generation of clinicians with that knowledge. It is a hard thing. It would be argued that medical school is dense with enough information, anatomy, physiology, pharmacology. Those types of topics are often cited as being should be optional electives. My personal belief is that we can't practice modern medicine without these technologies. We better equip our clinicians with the knowledge of what happens when they fail so they can still effectively care for their patients. The modern generation of clinicians, in my opinion, are not capable of safely caring for patients without things like the electronic health record, connected medical devices, and the old guard of doctors that were capable of caring for patients before the digital age are on their way out.
How can we better prepare that next generation of physicians to be aware of that legacy medical device to malfunction or to be targeted? You talked about medical students and your knowledge of an inadequate preparation of that. What about residencies? What about fellowships? Shouldn't that continue? Shouldn't that be the basis and then build on that basis?
That's a great question. I think it needs to continue throughout the entire medical education cycle, if you will. The only education I'm familiar of with residents and fellows, for instance, has to do with utilizing the electronic health record and protecting data, letting them know that if they violate HIPAA, for instance, that they could be fired or
too late then. It's too late. If we're making individuals aware after the defect has already occurred, we need to be proactive, and I think we can both agree on that.
I agree.
Mr. Garcia, you referenced in your testimony how continuing decreases in Medicare physician reimbursement impact the ability of doctors to upgrade or to replace vulnerable medical technology, especially for physicians in rural areas that I represented and practice. Declining reimbursement can ultimately make it unsuccessful to keep the doors open, to keep that access for the patients who need them the most. And the potential costs of more secure medical devices or the consequences of cyber attack occur in rural areas as well. With this in mind, Mr. Garcia, would you agree that for the healthcare cybersecurity to be improved, it is important for physicians to be adequately compensated?
Absolutely, Congressman. We have advocated that we need positive incentives for better cybersecurity across all healthcare systems, and what better than reimbursement? Follow the money. If you have a positive incentive that says if you do better in cybersecurity, if you can replace your aging medical devices, we will improve your reimbursement. It's that simple.
I think you really nailed it when you talk about how important cybersecurity is. It's important across all sectors, but it's incredibly important when it comes to patients' lives and when those lives are at stake. Moving forward, I am confident that this committee will be a leader in allowing doctors to be better informed and properly reimbursed so that they can be partners in improving cybersecurity for their patients and within their profession. Thank you, Mr. Chairman, and I yield.